Minister Jane Philpott announced yesterday she will be returning to the healthcare front lines to help with the outbreak. And she joins us now from Stouffville, Ontario. Thanks for joining us today.
Happy to be here, although not under these circumstances.
Absolutely. When you say you're going back to the front lines, what does that mean and what compelled you to make that decision?
Well, as you know, healthcare workers across the country are stepping up to make sure that they're available to do the jobs that need to be done. One of the needs in our area was for people to work in the COVID assessment center. Many of the hospitals across the country are adding additional facilities, often outside the hospital, to be able to assess people who are at high risk for potentially having COVID. I was a doctor on staff at Markham Stouffville Hospital for 17 years before I went into politics, and I have a bit of time on my hands before I start a new job at Queen's as their Dean of Health Sciences. And so I said, put me to work, and I'm working in the assessment center there now.
As a former health minister, I don't know how much of an opportunity you've had to see what Ottawa is doing. I'm sure you've been very busy yourself. But from what you've seen, how do you assess what is going on and the response by Ottawa?
Well, there's no question that all orders of government, as well as health organizations, are working around the clock to be able to respond to this. And I think everyone is doing the best they possibly can under the circumstances, working at high speed to be able to make decisions, to learn from what we've seen in other countries and other jurisdictions. And so I can do nothing but salute the hard work of everyone. It's hard to make those difficult decisions fast enough. And I think that we should be happy that we have had such a strong response.
The focus now seems to be on making sure that our men and women across the country have what they need to protect themselves and also treat their patients. So all the medical equipment and gear that's involved with that. Where is that fight as far as you see it?
Well, I think there is still anxiety around the needs and whether or not we will be able to respond, because it is extremely difficult to be able to predict where this is going. And obviously, it's better to prepare for the worst case scenario. So there are efforts going on around both the treatment capacity that's going to be necessary if there are high numbers of very sick people. But we're at the phase now where one of the real challenges is around testing capacity, and there's a lot of work going into that. There are more tests now that are being done than the current public health facilities can handle. And so I know that various organizations are working at trying to increase that capacity, because we need as much information as possible to be able to track where the outbreaks are taking place to give the very best public health advice.
Are we ready for a spike? We know there's a spike coming. Numbers so far have been creeping up and not spiking up. Are we ready for it?
Well, as I say, I don't know whether you can ever be as ready as you'd like to be in an emergency case like this, but it is not for lack of incredibly hard work and goodwill amongst all health organizations trying to move together in the same direction. I'm working as well supporting the Anishinaabe Aski Nation, some of the most remote First Nations communities in the north, and I know that there's a lot of anxiety around the infrastructure in those communities and whether they will be ready to be able to deal with possible cases or outbreaks in those communities. So I don't think we will be as ready as we would like to be, but I can tell you that it's not for the hard work of Canadians putting themselves together to support one another in this extraordinary time.
I know that there are other countries doing more. For example, some are saying, Britain, I believe, is saying to 65,000 healthcare professionals who are retired, come back, we need you. I know that's happening here, but that's on sort of an individual basis, people who decide to come back. Is there something that we could be doing that you see is missing from the equation so far we should be moving on?
Well, I can speak mostly to my experience at Markham Stouffville Hospital. I can tell you that I essentially put my hand up and said, you know, I'm ready to help if you need me. And the administration was unbelievably fast in responding to that. I quickly turned around everything that needed to happen so that I would get my accreditation there back up and running, and was able to start working right away. So I expect that that's the kind of thing that's happening everywhere across the country. And I have to just give a shout out to the people that are well behind the scenes on this, that make those kinds of things happen, because it's true that doctors, nurses, healthcare workers, lab workers, and administrators are all saying, what do I need to do? Canadians want so much to be able to help their fellow citizens, and it's a really beautiful thing to see it happening.
Jane Philpott, thank you for your time this morning. Appreciate you joining us on the program.
Thank you.